So a topic of focus today will be managing anxiety and depression during the pandemic. And for a lot of us, this has affected us in so many ways. And, particularly also there are a lot of other things that are going on that tend to compound this. So just want to acknowledge that this has been very difficult, and it still is, even with numbers going down. So today we'll particularly be discussing anxiety and depression during the pandemic and how we can manage that. Okay, just a little overview. Last week, our crisis counselor, Irada, shared with us about wellness during COVID-19. And again, today we'll be talking about anxiety and depression. Next week, we'll be talking about another common experience, which is grief and bereavement. And week 4 will be coping skills.
And when he was thing was on my screen, she logged into me. Okay. Because she couldn't log in.
Okay. And week 4 will be coping skills and self-care tips. And then week 5 would be staying connected with family and friends during quarantine. So I want us to start with how we think about fear. Right. And first, I want to assure us that fear is a natural part of our reaction to this pandemic and its effects. Like, we need it. A healthy level of fear is a good thing, and it plays a part in even how we're able to follow directions and do the things that we need to do. It gives us like the right amount of fuel, right, to keep to these guidelines and these safety procedures. And so if we didn't have that perception of fear, we may be a bit more relaxed in our approach, right, than we need to be in an urgent situation. However, when anxiety does intensify to this point where it disrupts our daily functioning, it does become a cause for concern. Anxiety can be defined as an intense, excessive, and persistent worry and fear about everyday situations. It may even interfere with our daily functioning. It can be difficult to manage and may be out of proportion with the actual reality. So as a result, we may start avoiding places and situations to avoid that feeling. And so we'll talk more about how we can modify our perception of fear and anxiety. So this here is what is called a cognitive triad, or I like to call it our triangle of self, right? Because we're people who are made up of thoughts, behaviors, and emotions, right? So I just want us to keep this image in mind as we go along. But in any given situation, right, we have these 3 components. We have a thought, we have emotions, and we have behaviors that are involved. And this is essentially showing us that how we think affects how we act and how we feel, right? Our behavior affects how we think and how we feel, and our emotion affects what we feel and, again, what we do as a result of that. So all of this kind of works together in tandem in any given situation. So one of my favorite examples of how this could work out, right, is the situation may be waving to a friend, right? So I see one of my friends across the street and I wave to them, right? And they decide not to wave back. At that point, I can think, oh, wow, this person must be ignoring me today. Like, what did I do, right? That is my thought. And then my emotion can be, oh my gosh, like, I'm really upset. That's so embarrassing, right? I'm embarrassed by they're not waving back. And then my behavior would be, you know what? I'm not going to call this person because they stood me up, right? So that is thoughts, actions, feelings, emotions going together and working hand in hand. And so we want to think about how can we approach any one of these given things, right? How might my action or my emotion be different if I had a different thought about that? Maybe I could have thought, oh, okay, she must be in a hurry, or I don't know if they wear glasses. Well, maybe she didn't see me, right? And that may cause me to feel differently about the situation. I may even laugh about it, right? And that changes what I essentially do. I may text her like, oh, I think I saw you across the street. You didn't wave back. I hope you're good, right? And that's essentially how this triangle works. So if we're able to approach differently our thoughts about certain situations, which so ties in strongly with how we feel about a situation, and then subsequently what we do, we may feel differently about the situations that we're in, or we may act differently towards them. So next I want to talk about a couple of triggers, right, that may influence anxiety and fear. So the first big one is media. I think in some sense, we're all connected to this, whether that's TV, whether that's newspaper, whether that's some form of social media, right? And media can definitely increase our awareness of risk. This is where we're getting a lot of information. But because it so increases our awareness of risk, we can become more vulnerable, right? We may think, wow, I must be really vulnerable because this is what I'm seeing all the time, or this is what I'm hearing. That has to be the main reality of what's going on, right? And I'm next. And so you want to think about what has been your own media consumption over the past few months, right? What has been some pros and cons about this? What does it make you feel like, right, when you've engaged with social media? Are you coming out with more information, or do you find that you're becoming more upset or anxious or fearful to do certain things that you would have engaged in the past, right? So we want to think about how this is impacting us, and is it really doing that for the better, or has it become worse the more you kind of engage in this? And so just a couple of solutions, right? Solutions can look like assessing your own intake of media. And you know what your personal limits are, right? And some of our phones kind of have this cool feature where we can even tell it to time us. You know, if I've been on this website for an hour, you can, you know, just buzz me or lock me out of it, right? So think about what your own personal limits are after you've kind of assessed, hey, does this make me feel better or not? If it's not making you feel much better when you walk away, think about, am I spending a lot of time on social media, right? What does it look like to cut back? Or when can I plan to turn my phone off for the day, right? So plan how you're going to engage in social media or media in general. And then think about what are some go-to sources for information and updates, right? Sometimes there's just a plethora of information out there. It's sometimes hard to sort through all of them. And so I want to think about what are some reliable sources, and this can include the CDC website. It has some really handy tips on health and safety updates. So we're constantly being informed accurately with what is going on around us in this pandemic. And we also want to develop an accurate perception of risk. As we mentioned earlier, yes, a level of fear is healthy, a level of anxiety is healthy, right? But when we do begin to notice that it's impacting and interfering with our daily lives, we want to think, what is our perception of danger? What feelings are coming up? And how is this impacting my action? You know, is this giving me an accurate view of reality, or am I kind of walking away with what is no longer reality about this, but has been magnified in a way that is now impacting me in a negative way? So those are just some solutions that we can look to when we're thinking about our media intake. Next trigger is the anniversary, right? So sometimes when we are looking at the media coverage has already done some milestones, right? We can think about a few months, or now we've reached this many thousands of lives lost, right? Those can be marks, those can be signs that trigger these feelings of anxiety, right? We're looking at the numbers climbing up, and media is constantly reminding us of what has been going on. We may have personal events and losses that correspond with this pandemic, right? So we may think a year from now, especially for those of us who've, you know, lost someone during this pandemic, we can think about birthdays, we can think about wedding anniversary, we can think about, you know, family gatherings that we'll usually have that has corresponded with this pandemic. Also, changes in the season remind us of the disaster, and that could be different for anybody, right? But we may have, the winter season, which some can now attribute to, okay, this is when it gets colder, and maybe this is when this virus becomes more powerful, right? Or maybe can be, the season becoming a lot darker. That can put us in a certain mood that is, sorry, that is also anxiety triggering for us. And so some solutions to think about is, give me 1 second. My voice has been going in and out today, but we will get through this. Some solutions when we think about anniversaries, this includes preparing for triggers, right? We can expect triggers to happen, and that is okay, right? If this particular event is reminding you of, the pandemic, or it reminds you of some kind of connection that you would have had that is no longer there, right? Let's think a year anniversary that just passed, with the pandemic, that could bring up some different thoughts for us, that can bring up a lot of different feelings. So, this can be expected, and it's definitely normal for all of us, right, who are going through this right now. And it's important to be patient with yourself, right? Again, going hand in hand with expecting that is knowing that I need to be patient with myself. You're not the only person who may be experiencing these anxieties, and so many people this resonates with, and so your experience is not abnormal, right? And another thing is also engaging in activities that uplift you. This could be volunteering. This could be, speaking with your family. I know Irada brought up a lot of different coping activities last week. She has a whole list of them, which we could also send out, but engage in that. You can also talk to someone. This could be family or friends. This could be our organization as well. We have resources to connect you with people who can talk to you on a plethora of issues. So feel free to reach out if it's becoming around that time. And also allow other people to support you. It's very easy to think, I don't want to bother anybody. We're all going through this. But that's all the more reason why we all need each other. And so if people are kind of initiating to bring you food, or to comfort you, or to come over, or to send something to you, because I know we can't all kind of get together at this point, but to kind of show their care and support of you, I would want to welcome and invite you to bask in that and allow yourself to be cared for, allow yourself to be supported. So like Irada mentioned last week, there's so many phases to this pandemic, right? And so the anniversary phase, again, is one of those huge ones. And we just want to prepare for that and anticipate this coming and think about how we can engage when that time comes. And next is sadness and depression. And this is also another huge experience for many people. And sadness or depression can be brought on by temporary losses, such as the loss of a job, or irrevocable losses, such as the death of a loved one. And so we want to look next at some factors that can maintain a state of depression. So the first factor that can maintain a state of depression is hopelessness. And hopelessness can sound like this is never going to get better, right? And especially in the pandemic, some of the triggers that can offset hopelessness are heavy news about the pandemic, prolonged social isolation, right? So being away from family and friends, having to be by yourself sometimes, an increase in cases, and uncertainty about the future, right? Some of us are thinking, we don't know when this is going to end, right? Is it gonna be like this for a long time? And also I want to think about what you would add, right? When you think about sadness and depression, what are some thoughts, right, that may have come up, or what are some triggers? What has been your own experiences that offsets this for you? If yeah, so what have been some of your experiences when you think about this? And so we want to look at some ways that we can manage hopelessness. And this includes, the first one is reappraising your thoughts. And a helpful phrase that I really love that I learned honestly at the beginning of the pandemic is that while things are bad, it's not hopeless, right? So hopelessness and the situation being bad are not necessarily, they don't necessarily go hand in hand. We can learn to see things for what they are, but also think about it as not being the end, right? And so again, I would love to reiterate that we want to consider our sources of information and know our own limits about what we can take in, right? Again, if this source, or even if this person, right, is being a constant source of hopelessness for me, think about how you might want to approach that, right? Do I need to interface less? Do I need to interact less on this website? Do I need to check out other things on the web, right? Do I need to limit the time I use? And then lastly, what are some positive things that have occurred during this time? What has come out of this pandemic for you? I wonder if some of you have picked up hobbies. I wonder if you've got more time to spend with people, maybe over Zoom or over call, that are far away from you, that you really have not talked to that much, if not for this pandemic. So kind of think about one or two things, right, that has come out of this that maybe would not have otherwise. And then the next factor that maintains a state of depression is helplessness, right? So helplessness can sound like there is nothing I can do to make a difference. Some of the triggers that can set this off is knowing that helplessness and hopelessness go hand in hand, right? So seeing a situation as hopeless can actually discourage us from taking action. And this is sometimes what we also call a self-fulfilling prophecy, right? This really happens when our expectation about something or someone leads us to behaviors that actually confirm those expectations. So for example, if you are like, oh man, these numbers are climbing higher and there's nothing I can do, I can't make a difference, then it's very easy to kind of just take a step back and not do what we can on our end to impact our own side of the world, even if that's your home, even if that's just you, right? We are not as motivated when we just say, this situation is helpless and nothing I do can make a difference. And so let's look at some solutions on how we can manage helplessness. And so this can include with starting small, right? Do what you can in your own corner of the world. This would really help to build momentum, right? Imagine if all of us were actually, washing our hands and we're putting on our masks and we're social distancing, right? It's one person doing something that has become, a magnified effect, and it's all making a difference, right? Compared to the opposite, which could be, oh, well, I'm not going to. And I think I'm going to cough loudly, right, when I'm in the midst of people, because there's nothing I can do as a single person to make a difference, right, to make a dent in this situation. And so this could look like, again, following the health and safety guidelines. This could include sharing your learnings from this webinar with your family and friends. So you all already have a lot of information that people may not have, right? All of these coping mechanisms or how, disasters work, you all have insights to that, and you can also share. And I just want you all to know that caring for yourself is doing something, right? Sometimes it's easy to become weighed down and overwhelmed and sad and depressed about the situation. And I want to encourage us that caring for ourselves is doing something. And in doing that, we're able to help, we're able to support other people. So don't take that lightly. That is that if that is all you do, right, you are working to preserve yourself and be there when other people also need you. And lastly is social disconnectedness and loneliness. And some of the triggers that can impact feelings of social disconnectedness and loneliness are, again, these safety measures that do emphasize quarantining and social distancing. And so that can result in thoughts such as, I'm alone and I will be for a while. And again, that just increases these feelings of disconnection. So while these safety measures, are really helpful and they're there for all of us to keep safe in a time like this, I can also imagine how this can also really exacerbate the feelings of feeling isolated, which can also, again, lead to feeling depressed and feeling sad because we are we may feel alone in this. And so some solutions is first, knowing that your feelings around this is very valid, right? In one way or another, we may not have had the same level of interactions that we once did with the people in our lives. And that could be very distressing for a lot of us, right? So it is very important to just know that, yes, feeling, disconnected from other people, it's not normal, right? In a lot of circumstances, some of us maybe don't live alone every single day. We have family coming over every week or for Sunday dinner, right? So not having those interactions can really have an impact on us, right? And that tells you that, this is a part of me that I no longer have. This is a part of me that brought me joy that I no longer have, right? And so one thing to consider also is reframing social distancing with physical distancing, right? Sometimes the words around social distancing can sometimes make it feel like, I need to be in this world all alone, or, I need to keep a part of my relationships just now, like in this cubicle, right? I can't engage. And I can't have as rich relationships as I did because I'm I'm socially distancing, I should say. So let's just try to separate those two, right? And think of it more as physical distancing, right? I am distancing myself across from you, but I am socially connected to you. So we can still cherish and foster these relationships with our loved ones. And they're many ways to continue to do that. And I think it just keeps getting more creative over time. Obviously, we're all aware of Zoom. This is where we're at right now, and we're able to attend virtual events such as these. There are many fitness events. There's also, events. I know Airbnb kind of has this thing where you can, engage in other cultures. You can go to a different country to learn how to make coffee, and that's just all by viewing and having someone telling you and sharing that information with you. So these are just some ways. Another cool thing is a long distance friendship lamp. So when you touch it on your end of the world, this works across the world, someone else that has that same lamp could also get a feel for that. So it lights up on their end, and it just kind of lets you know that you're both thinking of each other. And just as I round up here, I wanted to share some resources. If you are dealing with some of these emotions, I do want you to know that the National Suicide Prevention Lifeline is there 24/7. You can talk, call, or chat online. There's also the Elder Locator website, which has resources on finding housing, transportation, and benefits in your community. And also the NIH, which gives resources on safety and vaccination guidelines. And lastly, I just want to share about NJ Hope and Healing. Again, we provide a lot of different resources. We have short-term crisis counseling, emotional support, informational webinars such as these, and also referrals to additional resources. So if you have any questions, this is the link to it. And I would also, send out, I believe Dan would have this. He'll also send out a little one-pager with all of the information condensed here, so you would have access to that. So again, thank you for joining us today.